Good morning, ladies and gentlemen. I'm very pleased to see that so many of you have been able to fulfill your Sunday obligations and get here on time. And welcome to the second plenary session, a session on sustainability of the HIV response. This is a very timely discussion, and it's a discussion that the panel will use to follow up on discussions that took place on Friday at the PANCAP AGM, where at that point in time, the AGM looked at the issues of sustainability, looked at questions of efficiency, looked at questions of where is money allocated, and then also, too, putting that in the context of all of the global changes that are taking place with the traditional sources of financing, and asking, how do we sustain a response? How do we find the resources? How do we use them better? And this morning we have a very eminent panel with us to discuss this issue. And let me introduce our first speaker in this discussion, Professor Alan Whiteside. Professor Whiteside is a professor of health economics and director of the HIV/AIDS Research Division, which he established in 1998 at the University of KwaZulu-Natal in Durban, South Africa. He's been involved in researching HIV/AIDS for more than 20 years. Based in Southern Africa, he's made his mark internationally as the author and co-author of seminal books in the field. These include HIV/AIDS, A Very Short Introduction, AIDS in the 21st Century, Disease and Globalization, and AIDS, The Challenge for South Africa. He's written numerous book chapters, academic papers, and serves on the editorial board of the African Journal for AIDS Research, Development Policy Review, Globalization and Health, and he's the author of the Journal of the International AIDS Society. He's someone whose work I have read many times over the years, and I'm indeed very pleased and honored to introduce Dr. Alan Whiteside this morning. Thank you very much.
Thank you very much indeed. It's a real pleasure to be here. I've never been to the Caribbean before, and I must say it's quite exciting to be here. But I did grow up in a little town, in a little country, Swaziland, the sort of place where if you held hands with someone downtown, your mother was phoning their parents to arrange the wedding before you got home. So I think we have something in common in terms of knowing small towns and small places. I was asked to talk on what is realistic sustainability within the context of a multi-country regional HIV response, a perspective from Southern Africa. If I keep repeating that, I will obviously have finished my presentation very soon. I want to begin, though, by saying something that might rather surprise you. I envy you in the Caribbean. I envy the size of the problem that you face. It is small and manageable. I envy the response that you've developed. Everything that I've heard in the last 2 days indicates a mobilized society with activists, researchers, government officials, international agencies working together. A society that is doing pretty well. I envy your future to manage this epidemic. Perhaps it's time, and we don't often do this in the AIDS world, to stop and give yourselves a pat on the back. And you're going to see why I'm saying this as I talk about the situation in Southern Africa. Let me begin by locating the two parts of the world I'm going to talk about. Southern Africa is that bright red area at the bottom of Africa. When we first saw this map, we talked about the red countries of Africa, and then it was decided that it was a bit stigmatizing. So we don't talk about the red countries, but they are red. They're red because the epidemic is out of control in that part of the world. And then over there are the Caribbean islands, and as my good friend Roger McLean says, some of those may be dots of specks on the screen, but they are probably islands. Small countries, and relatively unread. So I know Southern Africa. I don't know the Caribbean. But in preparing this talk, I decided it was important to try and make statements and comparisons and to try to be bold. And I hope I'm going to do that. If I'm wrong, please correct me at the end. What I'm going to do in this talk, in this 20-minute talk, is begin by setting the context. I want to just touch on the epidemiology. I want to spend a minute on definitions because these are quite important as we look at what sustainability, what multi-countryism is. I then think the really important question that we need to ask ourselves is, what are we actually sustaining? What do we want to sustain? And here I think there are three big issues: prevention, treatment, and dealing with the impact of this epidemic. And then finally, I will try to pull some lessons out for this conference and for moving forward. A comparison of the epidemic shows us that there's some significant differences. The biggest one, of course, is the scale. We know that the Caribbean has the second worst epidemic in the world, but it's 1%. In Southern Africa, we're talking about 15% and more of adults. What a difference. There are some differences with regards to the mode of transmission. In Southern Africa, it's unprotected heterosexual intercourse and mother-to-child transmission, which has driven up the numbers in our region. Here, it's sex work, MSM, drug use, and that is something which you should feel really is a benefit because it gives you targets to work towards, it gives you people to work towards, whereas in Southern Africa, actually, it's nearly everybody. But there are also some similarities. One of them is that we've both seen the great successes of rolling out antiretroviral therapy. Yes, deaths are going down in the Caribbean, in Southern Africa. There are fewer people dying. There are more people on treatment. The other similarity, of course, is that we have more women and girls in our areas than men and boys. And that's quite an important one. And I want to touch on that for a few minutes because I think that this issue of gender is something which is absolutely critical, and maybe there are lessons we can learn across the regions on that. Another similarity is that there are huge differences between the countries. Huge in the Caribbean in a small epidemic. Huge in sub-Saharan Africa in a massive epidemic. And there you can see that the prevalence runs from about the 0.1% in Madagascar right the way up to over 25% in Swaziland. The truth is that Southern Africa has high prevalence, desperately high prevalence. Going back again to a map and showing you the red countries of Southern Africa, you can see that if you move south from Zambia, Zimbabwe, the countries have prevalences which are just completely untenable. So what are the lessons from this? One is to try to understand what is driving the epidemic, why rates are so much higher in some countries than others. And I have to say, we don't know the answers. There's also a lesson here for us to take from you. How did you stop the epidemic? Where there are differences between countries, why are there those differences? When I started preparing this presentation, I thought, what are the lessons I can take from Southern Africa to the Caribbean? And I have to be honest, I'm not certain how many there are, and they're lessons perhaps of what you shouldn't do rather than what you should do. And certainly as I have prepared this talk and as I've listened to the presentations at the conference, I think we've got a lot to learn from you. But let me just give you an illustration of one part of the epidemic. What I have put up here is the Demographic and Health Survey data from Swaziland. Peter Figueroa yesterday spoke about DHSs. In 2006, we had a demographic and health survey in Swaziland. What I want to show you on this slide is where you never, ever want to be. Ever. Because what this shows you in the younger years is the children who are infected through mother-to-child transmission. 4, 5, 6%. That's unacceptable. But then, if you keep following the line, the red one being females, you see that suddenly, as girls become sexually active, HIV prevalence starts increasing at a catastrophic exponential rate. Until by the time you are a 25 to 29 woman in Swaziland, the chances are that 1 in 2 of you is living with HIV. Here is a clarion warning for the Caribbean. You never want to be there. Never, ever. So how did it happen? Keeping looking at that slide, you can see, if you look, the darker line is for men. And you'll notice that it is slower, later, and lower. But you'll also notice that difference between men and women, where older men are infected and younger women are infected. Older men are the ones who carry the infection, as do younger women. What is this telling us? This is telling us something about intergenerational sex. This is telling us things about gender relations. This is telling us that in unequal societies, we have to be aware of power, of agency. These are things that are as valid in Swaziland as they are in Jamaica, in Barbados, in the Bahamas. So that maybe there are some lessons. Maybe one of those lessons is that the epidemics are not that different when it comes to some of the fundamental issues. But as I said, you never, ever want to be at that level of HIV prevalence. Just to give you another example of the scale of the problem, there are nearly as many people who are infected in Botswana, a country of just 1.8 million people, as there are the total population of the Bahamas. That's crazy. How did we get there? Coming back to the outline, let's just spend a few minutes on definitions. What is sustainability? I'll let you read this definition, but let's stress the words long-term, the word stewardship, and responsible use of resources. That is a good definition of sustainability. And one of the reasons it's a good definition of sustainability is because it means you and I are responsible for sustainability. We have to be stewards. But let's be clear, it's not going to be easy. This is a rather complicated slide taken from the work of Meadover and Jeff Garnett, presented at a meeting called Rethink HIV. And I put it up because of Anthony Fauci's presentation yesterday, where he talked about the challenge for treatment. If we simply want to keep people on treatment, then we need $17 billion a year. Or to put it another way, if we're going to carry on with what we're doing and not contracting, which is probably an important question, can we avoid contracting in a situation of diminishing financial returns, then we need 17 billion. If we want to continue our treatment programs, our AIDS programs at the same level, then we need 19 billion. If we want to increase and put more people on treatment earlier, we need 29 billion. So those are the choices. Sustainability means just carrying on where we are. But is our challenge not the bigger one of expanding? Is sustainability the best we're going to be able to do? Because surely the target is to increase the number of people on treatment, to increase the prevention activities that work. I believe that we need to remind ourselves sorry, I'm just going back a slide. Also, what do we mean by regionality? multi-country is, and this is a big debate that we've been having in Southern Africa. What do we mean by regionality? And one of the reasons why we've been having that debate is because we had donor money that was regional donor money. And basically what we had was people saying, we'll give you resources, but it has to go into the regional pots. So what did you mean by regional? Well, the answer was multi-country wasn't enough. You actually had to have something which was regional. And I think this is something where, looking at the Caribbean, you actually do incredibly well. You operate on a regional basis. This is the supranational Caribbean organizations, and it's interesting. You've only got 3 major regional organizations, or RECs: Eastern Caribbean States, the Caribbean Community, the Association of Caribbean States, and some lucky countries are members of all 3. But more than that, you've got other regional activities which I've been hearing about going on. PANCAP, amazing. The way in which the university comes together. I really think that when you look at that and that, which is African regional organizations, the Caribbean is doing pretty bloody well. My countries are the Southern African ones. And I have to say, I quite envy you the way you're operating in a regional manner. Okay, let me come back to the outline again, and let's move on to the sustaining what. I think there are 3 things that we need to talk about sustaining. One is prevention, the second is treatment, and the third is impact mitigation. And I need to spend a bit of time on that. And the reason is quite simple, and this is a graph which was developed 15 years ago. It's as valid today as it was then. When we look at this epidemic, there are 3 curves. The first one is the HIV curve, the number of new infections, the cumulative number of people living with HIV. If that goes up, then you know that you are going to face AIDS cases. And in this day and age, that means people who require treatment. If that goes up, you know you are going to face impacts. You are going to face children who are orphaned. You are going to face people for whom food is a requirement because they're taking drugs. You're going to face changes in your society because you have an epidemic. So what do we want to achieve? I believe the biggest thing we want to achieve is sustainable prevention. And it's obvious. And again, I can refer to what Anthony Fauci said yesterday. We have got a situation where there is a growing caseload. It's not tenable that for every 1 person we put on treatment, we have 2 who are being infected. We've got health systems which are stretched beyond belief, particularly in Southern Africa. And we've got a situation where we simply do not have the human resources in order to provide the support and the care. And finally, we've got the issues of money. All of those occur if we don't get prevention right. So the challenge surely is for sustainable prevention. And that, let me again reiterate, listening to the presentations yesterday, is something that you've done really well on in the Caribbean. But you can't take your eye off that ball. You need to be monitoring, you need to be watching, you need to be working out where you need to go into the future. So, if we talk about the challenges for prevention, what are we talking about here? Well, first of all, I think we need to be aware that the costs are huge. If we talk about the resources, obviously for every person that we manage to prevent getting HIV, we are going to save a great deal of money going into the future. In some settings, as much as $800 a year. They say in public health that an ounce of prevention is worth a pound of cure. Certainly, this is something that we need to achieve, we need to sustain. There are things that are going on for us in Southern Africa where we already face this massive load of HIV infections that are good news. Prices are coming down. We in South Africa managed to bring down the cost of antiretrovirals significantly. This is a slide which shows the cost of treatment in South Africa alone. As you can see there, the red bar is the cost of treatment. As you can see there, we're talking about something close to 35 to 40 million rand, which is about billion rand, which is about $10 billion per year for treatment. Where could we have put this money if we didn't have the epidemic? Could we have put it into education? Could we have put it into healthcare, housing, schools? Why, one has to ask, have we done so incredibly badly that we have to face this burden on our exchequer with regard to treatment? And I'm not saying we shouldn't do that, because of course we should. But the worst of it is when you look at that graph, you can see it going up, because the prevention hasn't worked. As the Ugandans say, AIDS treatment without prevention is mopping the floor while the tap is running. That is so much the case in Southern Africa. Is that the case here? I suspect it is. And I would suggest that one of the fundamental lessons from Southern Africa for the Caribbean is to get your prevention right. You never want to be in the situation we find ourselves in. So what works in prevention? Well, again, if I turn to what was said yesterday, we know that prevention of mother-to-child infection works. We know that male adult circumcision works. We know that condoms work, and I think it's a sadness that the importance of condoms seems to have slipped off the agenda, because we know they work. Potentially, we have some scientific interventions, the microbicides. I'm a bit more optimistic about those than I am than Dr. Fauci was. We may have a vaccine, and the International AIDS Society has just started a major initiative finding the cure for AIDS. We also know that behavior change works. We know, and this is something which has been well picked up by many of the social scientists, that there are behavior changes that work. Fewer partners, less concurrency, later sexual debut. But we also know things that need to be addressed around poverty, economic inequality, gender inequalities, leadership and policy. And if I were to add one other point to the slide, I would say it is substance abuse, and particularly alcohol, which is a major driver of the epidemic in my part of the world. But we also know that resources are limited and declining. And this slide comes from my good colleague, Robert Greener, who shows the global annual resources available for HIV and AIDS. And as you can see, the AIDS epidemic has reached its peak in resources, and it's probably reached its peak in global interest. I think that, and again, if I may say, the Washington conference next year is going to be really, really important, because it is going to be a moment at which we will be able to try and rekindle global interest in the epidemic. There is one other thing that I would touch on before I move to my conclusion, and that is a commonality that you and Southern Africa has. We are still stigmatizing people who are infected, and in particular, we are still stigmatizing men who have sex with men. You may be aware that in Malawi and in Uganda, there have been men arrested, put in prison, beaten, and murdered. You probably know that President Mugabe of Zimbabwe said gay people are as bad as pigs and dogs. This is an area where I think you in the Caribbean and we in Africa, Southern Africa, need to address moving forward. We in South Africa have a constitution that is a model of how this should be done. But putting that into practice is complicated and difficult. I want to end with just 2 slides on the lessons that we might learn. We know that there's a variation between the countries. We know that we have a horrendous epidemic. But we do know that regionality is really a way forward, learning from each other, acting together. Procurement of medicines, for example. Best practices, for example. Regional integration has to evolve. I was so struck by the statement yesterday that we need to learn from each other. The way to walk fast is to walk alone. The way to walk far is to walk together. And if there's one thing I can see from the Caribbean, it's that you've learned to walk together. Finally, prioritize. And I show this slide from Swaziland. I'm going home to that little country I know and love in southern Africa. Because they've said, one thing we have to do is prioritize. And I think even in a setting, in a region with a low epidemic, this is something you need to be thinking about. Because if there's one thing we need to wake up and realize, it's that the resources are not going to increase. So where are we going to put our efforts? Where are we going to put our money? What are we going to do in order to prioritize? And that perhaps is where I will end, leaving you with that challenge of you are doing amazing things. You have an epidemic here which is a fraction of ours. You are working together. You need to prioritize, though. You need to work out where you need to be. Ladies and gentlemen, what a privilege to come to a conference like this and see a celebration of success, because I think that is what you have. I think there are things you can learn from my part of the world on regionality, on multi-sectoralism, on integration. But the one thing you need to learn and take away is never get to where we are. You haven't yet. Let's make sure you don't. Thank you very much.
Thank you very much, Alan. I think, as I listened to that presentation, it perhaps is one of the most stirring pieces reminding us of the strength of regionalism, something that extends back over 50 years in the Caribbean, back to the Federation, and the accomplishments that we've had by working together. Our next speaker is Dr. Amalia del Riego, a national of the Dominican Republic, but I also consider a fellow Trinidadian in many ways. She's currently the senior advisor for PAHO WHO for its HIV/STI Caribbean office, with the responsibility to coordinate the implementation of PAHO's HIV/STI work in the Caribbean. She has 20 years of experience in public health with an emphasis on HIV and STIs, and health systems and services development. And she's also, too, very passionate about the need for us in this region to eliminate mother-to-child transmission. Amalia, good morning. Pleasure. Please welcome her.
Thank you, Ernest, and good morning, everyone. I'm actually, I was born in a very small village of the central north in the Dominican Republic, and I am proudly a Caribbean woman, short but not shy. And I think the panel discussion really is a very challenging one, and one that we will need to manage with a lot of non-diplomacy, because it is going to be one that need to highlight, based on our successes, also tough questions about what we should not continue doing. And I think Alan's previous presentation was a very good introduction to my presentation. And the other thing that I want to say is that the reflection about sustainability, and I'm going to share with you, is really a product of a lot of discussions with many of you, many people that for the last year and a half have been exploring this question of sustainability. And I will recall a year and a half ago, or maybe more, sitting down at the airport waiting time, when one colleague asked me, how is it that we're going to make it? And what will be the key to sustainability? And my answer was, when we will find the answer when the money runs out. And it may be paradoxical answer, and I was probably tired, and it was not politically correct. But I was really coming from another meeting, very frustrated of seeing the amazing amount of financial resources available to the region, and when there were still so many challenges in identifying the effective use of those resources. And therefore, I will say that my presentation will try to take three different perspectives. One is this region is a diverse region, so the Caribbean cannot have one approach. One size will not fit all. We discussed that in the PANCAPE GM, and we all know what that means. The other thing is that the look into the future is really, and after a very long journey, is really at this moment, and I will take the brilliant presentation yesterday in the first plenary from Dr. Anthony Fauci about where we are in this journey. And two key things that he mentioned, and he ended his presentation was, well, we know what we have to do. We need to prevent new infections, and we need to ensure that we decrease the pool of HIV-infected individuals who can transmit the virus. And therefore, the question here is not longer how much we need to do, how much we have done. We know we have done a lot. We know we have great achievements. But the question right now is, at what cost, how much more we need to do, at what cost, and who will pick up the bill? And therefore, when Alan mentioned that sustainability, when we talk to discuss about sustainability, we need to say sustainability of what? I would like to say that for the Caribbean region, and my reference will be very on the ground to our region, the sustainability discussion needs to really be framed in the what. And the what that I think in this region we are saying is this region really can have the vision of HIV-free generations. And is that an impossible dream? I will say no. I will say there is clear evidence of successes, and I will not repeat what we have been saying, but I want to highlight elimination of MTCT is really feasible. We have actually several countries that are, at this moment, either have achieved elimination targets, and the Prime Minister mentioned in his opening remarks that the Bahamas didn't have any reported case of MTCT 2010, but we know that Barbados have not had any reported case in the last 4 years. We know that some of the small island states like Anguilla, St. Martin have no reported cases. So we have a quite significant amount of countries that are either at this moment have eliminated, and we need to validate that, or will be eliminating MTCT. And we know that we also have countries that lag behind. We have seen a significant amount in the reduction of mortality. We have seen, I will not say dramatic decrease of new reported infections, but some countries are getting there. Some other countries are, we see the stabilization of new infections. And we have also seen that all countries in this region, all countries have scaled up significantly testing, treatment, and care. So that in the context of the Caribbean, I think the question that Alan placed before on why are a little bit clear. I think we know that we have really implemented effective interventions. And I think one element that we all recognize in terms of the sub-region is that of the political commitment. In this region, we have had really incredible political commitment to the fight of HIV/AIDS. And with all of that to be the starting point in this journey today to the future, then I will challenge to say that our vision for sustainability needs to be the sustainability of and HIV-free or HIV-free generations in the Caribbean. And I would like to also challenge to have some reflections about what is really exactly linked to those successes. And there have been quite a bit of analysis and evaluations conducted in the last 3-4 years in the region by PAHO, by PEPFAR, USAID, by the World Bank. And these evaluations really are clearly indicating that a lot of the successes can be linked to a sound public health approach. And I would like to say a sound public health approach with the elements of understanding of a sound public health approach. Health in this region is recognized as a fundamental human right. I don't think there is any country in the Caribbean that will not have health as a fundamental human right. A sound public health approach that really has looked at effective programs and services. A public health approach that have really ensured social participation, community involvement in addressing the social determinants. And I think Alan mentioned some of them: gender, equality, poverty, stigma and discrimination. And we need to act in this region. We saw that in the presentation yesterday too by Dr. Jean-Pep. Natural disasters as social determinants. I think we all recognize also that there have been a very strong public health leadership related to these successes. And I would like to mention that it is not by coincidence that we can see now some of the interventions getting results, because in the very early onset of the epidemic, all countries established national AIDS programs in the ministries of health. And by 1987, I think all of the countries had a very vibrant national AIDS program. And the national AIDS program that at that moment revolutionized public health. Because I do recall in the Dominican Republic when the first interventions for sex workers and men having sex with men were developed by the National AIDS Program with a lot of criticism and challenges. So that the approach at that time was that of a public health leadership. And we have seen also the regional response that have quite a bit of the public health leadership element. And we have seen the recognition of many individuals in this PANCAP AGM, also in the previous one, Bilali Camara, Dr. Perry Gomez, Dr. Carol Jacob, Professor Figueroa, Suzette, and I will say we have many more that are there and will deserve a prize, and we actually will have to include many, many prizes. I met yesterday Sister Claire from the Bahamas, who is a public health leader that have been really working very hard from the very onset of the epidemic in establishing sound support programs in the Bahamas. She deserves a Nobel Prize. And I would like to highlight that we have all acknowledged and UNAIDS have recognized PANCAP as a best practice in this region, but let's see what really have moved PANCAP so far. And I will challenge to say that it's really the public health leadership that have moved PANCAP to this point. We have seen how the ministers of health have taken a proactive role in advocating to the highest levels of government in crafting the NATO declaration, in establishing the PANCAP, and in managing the PANCAP for 10 years successfully, and with the ability of implementing a strategy for involvement, multisectoriality, more collaboration with civil society, and that is a sound public health leadership. Now, having said that, what are really the issues that can hamper sustainability? And what we have seen in the different evaluations and doing the literature review is that we have some great inefficiencies in the way that we are doing business. We have a very high cost of producing the results. And a lot of the high cost, in our perspective, is really due to a great extent, to the verticality of programs and services and the duplication of functions that we see overall. We have issues of governance with very complex structures of the national response, and I was hoping that Professor Theodore was going to make his presentation before me, because I was going to say that one of the elements that he will put forward and he shared with us in the last PANCAP AGM about the whys that we need to be asking ourselves is, why is it that some countries in this region will have 40% of administrative costs for the response, when some other countries will have less than 10% of administrative costs for the response? And we have some answers for that. And we know that when we look at the differences, one very important element coming out is the complex structures to manage the national response. We have issues of oversight, normative function that are not fully realized. We have issues of public-private partnerships. We have a lot of things happening in the private sector, I will say with very little regulation, but also with partnerships that are not totally materialized. And then we go to the issue of financing. And some countries still have a very high dependency on external resources. That will really hamper sustainability. If we are really aiming to get there, we will need to solve that issue. And the issue for financing is that cannot be taken for HIV in isolation of what is financing of healthcare. And if we think that we are going to resolve the financing of HIV services and the response without addressing overall financing for healthcare, we are totally wrong. We also know that at this moment, we have important barriers for access to care by key populations, and perhaps a lot of that related to stigma and discrimination. If we want to reach those infected individuals that we need to early intervene and provide treatment for prevention, then we will need to address the access element. And we have seen also in all of the countries that maybe this is where the challenge is, because we have done very good in scaling up services for the general population, but our key populations, and specifically those that are more stigmatized, men having sex with men, sex workers, and I will even say the youth, have really extreme difficulties in accessing health services. And I want to put the youth because we have seen also that in many countries there is a big discrepancy in terms of the age of legal consent for sex and the age of at which you can actually access health services without consent from your parents. I want to also mention that an important element is that of quality of care and treatment, because if we are to reach there, we need to really pay attention to prevention of HIV drug resistance. And I think Alan made a good reference to that. We not only need to put people on treatment, we need to prevent that we will move to expensive regimes. We need to prevent that. The transmission of HIV will be that of resistant HIV. And then I will also say that another element will be the effectiveness of the prevention interventions. The findings in the evaluations really are very striking in terms of a lot of activities happening in prevention that we cannot necessarily link to a specific impact. And therefore, that is really a challenge for sustainability. And then I would like to really reflect on three specific areas that are key for sustainability in this region. One is the area of service delivery, and I will expand on that. The second is we must improve efficiency. And the third is the financing and allocation of resources, because we will need maybe not more money. So in terms of service delivery, three specific interventions. One is the early detection, care, and treatment need to be expanded, and specifically we need to deliver we need to develop service delivery models that can actually be reaching key populations, and in particular develop public and private partnerships. We need to really pay more attention to evidence-based prevention interventions, and I will challenge to say that we need to operationalize the concept of combination prevention, and we do need to start to talk about treatment as prevention. Despite the fact that we know treatment costs may be high, the question is not only how much is the cost for treatment, but the question is how much will cost to have people that need treatment and are not in treatment. And I think the other element will be, in terms of service delivery, the prevention of HIV drug resistance. We need to improve efficiency, and for improved efficiency, our reflections are that we do need to move to integration. We need to strengthen our primary care, and for that, we need to take a health system strengthening approach. That is not news for us. The question is how we're going to do it. We need to simplify coordination and management structures, and we need to really be more on target with strategic information. We really need to change some of the ways of getting strategic information. Our surveillance need to tell us what is happening with the new infections. Yes, we need to know about prevalence, but what is happening with the new infections, where the new infections are occurring, what the characteristics of that population, because it's that information what will guide strategically our programs and interventions. And we need to really do some more focused operations research to ask some of the whys, this or that. In terms of financing, I think when we talk about evidence-based, I will say that we also need evidence-based allocation of resources. We need to do more analysis that will be cost-benefit. And I am not a health economist, but the cost-benefit analysis will be extremely important in that in this time. We also need to relook at investment for the external resources in the next 5 years, because we all know that we still have a significant amount of external resources available to this region, but we also know that that significant amount of resources will dry soon, and that maybe in the next 5 years we will not have that luxury. And then we will need to start addressing from now the aspects related to national health financing, to include the financing of HIV. So is this an impossible dream? I think no. I think it is a dream that we should pursue. I think that we have clear important gains that we need to sustain. I think there is an overall recognition of the need for strategic interventions now, and those are reducing costs, improving efficiency, and having tough allocation choices. We need to decide what of what we are doing we need to stop, and that is recognized too. And I think, last but not least, we have as a region the know-how, we have the passion, we are very proud people, we are not shy, and if you want to know that, go to the Miami airport, we were just commenting that. You will find the Trinis and the Dominicans speaking loud. And I think we have, we have all of our countries a strong national pride, and we have a collective pride of being Caribbean. And therefore, without going into political or commercial announcements, yes, we can, let's do it. Thank you very much.
Amalia just said to me, "Si se puede." Yes, we can. I'm just going to hold on to a couple points from that last presentation that I think should stay in everyone's mind. And that is the whole question of looking very seriously at efficiencies. The counterside of that is being able to acknowledge the inefficiencies that we currently have in our programs. And also, too, to have a look, again, at the allocation choices we're making. Where are we putting money? The counterside of that is, where do we not put money? Where do we need to put money if we are to have successful prevention and treatment programs? The next presenter, Dr. Carl Theodor, is going to further this discussion in looking at sustainability, looking very much at it from a fiscal point. What are some of the fiscal options? What do governments need to do? What has the region done previously? And Professor Theodore is the director of the Center of Health Economics at the University of the West Indies. He's also professor of economics in the Department of Economics, where he has taught health economics and generations of students across this region for many years. The work of the Health Economics Unit, which is one of the unique institutions within this region, has contributed to an improved understanding of the economic impact of HIV in the Caribbean. He was one of the people leading one of the first studies in this region over a decade ago, looking at the economic impact of HIV in the Caribbean. He's now responsible for training many young health economics and their understanding of the HIV/AIDS response. He's led a variety of research initiatives looking at HIV and health, but also, too, looking more broadly at economic issues of health and development in the Caribbean. It is my great pleasure to introduce Professor Carl Theodor.
Thank you very much, Ernest, and good morning to you all. I listened to the first two presenters and I kept wondering, it's rough to be a third presenter, because in fact most of what you want to say has either been said or been touched upon. But then, knowing myself, I suspect there's something I will say which is slightly different. Just quickly, the outline, I want to touch on the issue of sustainability. And I'll begin by looking at the regional context, and then we'll look at what the funding requirement, because the focus will be on the financial sustainability of the HIV response. I'll have to touch on the issue of fiscal space. I'll make some broad suggestions for moving forward, but then one specific suggestion I call a bold step. I want to touch on that, and then a few summary statements. the dimensions, as we heard yesterday, the epidemic, and as Professor Whiteside said this morning, we are not doing too badly, but there are challenges. And yesterday they were shown very plainly. We have some countries, a few countries, where the epidemic seems to be under control. The new cases are reducing. But for most of the countries, that's not the case. We saw yesterday there are countries where the ratio of men to women was 2 to 1, and in others, women to men was 2 to 1. And we just don't know why. We also saw that the rate of decline of new cases over the last decade or so has been very slight. We also know that the economic situation in the region is not looking too good now. Countries reflecting low rates of growth or declining rates of growth. And the third aspect of the dimension I want to just touch on is the fact that this is a region where many of the countries have been dependent on external resources for the response, for their national response. But the facts are that those sources are going to be drying up. We point to one source, DFID. DFID says it's going to cut its support by 32% to the rest of the world, and it's going to cut the support to the Caribbean by 100%. So we have nothing to get from DFID. And that is what we have to keep in mind. The challenge then is, I think there are two aspects to the challenge. So we have to find more resources from within the region, and it's really fiscal space, because it's governments mainly that will have to lead this response. But also, as the two previous speakers mentioned, it's really a question of doing more with less. We really have to commit ourselves to do more with less. What then is sustainability, but what it is we are looking for? What kind of resources we are looking for? Well, a few years ago, the HU and the World Bank worked out in a fair amount of detail what it would cost the countries of the region, each of them, to respond to the epidemic. And based on that, we have been able, in the HU, we have been updating that number over the years. And the last update says that for the region as a whole, the cost will be somewhere between $300 and $500 million per year, depending on how much we have to pay for the drugs. The figure we like to use is the 300 million as our target. Now, that we had worked out is the amount that as a region we are going to need. In fact, when you look at what we have been spending, we have been spending just a bit more than half of that over the last decade or so. So I'm saying, if we are looking, in fact, if we are looking to do a bit more, then it could be then that what we are looking for as a region is roughly about $180 million per year, which works out in terms of the income of the region, which is a little more than 60 billion. That works out to, as you see on the slide, 3,000, which is 0.3%, a very small fraction. Now, on the face of it, talking about sustainability, if you're looking at 0.3% of your income, that shouldn't be much. That shouldn't be much. Yet, there's a sense in the region as if that is a tough question. It really boils down, as I'm saying, to the political will, that commitment that we need to, this is a serious epidemic, and that small fraction, we're going to have to find it. That is the commitment, I think, that we need. Now, some people don't like to hear me say it, but that this region has always been in a position to finance its aid. It has always been, because the amount that was required was always a very small fraction of our income. The facts are that many of the countries were in difficulty, and we were grateful for the external support that we have been getting. But I'm sure even the donors would agree that the time has come when, in fact, the countries have to look more seriously within themselves to continue funding the response to the epidemic. Just to look at three of the countries. I call them country A, B, and C. I don't want to call names. One country, between 2002 and 2009, those 7 years, spent $50 million US on HIV. But over the same period, that country's income was $135 billion US, and they spent $50 million. So they're spending 0.05%. 0.05%. That is so close to zero, it is almost embarrassing. The second country, much better. The second country, in fact, is spending on its health 5%. On the HIV, it ends up spending 0.2% of its income. Now, given that the benchmark we mentioned just now was 0.33%, the country spending 0.2 was still spending less than what we think it should be spending, but it's still not too badly off. And the third country is even better. The third country C, the data tells us they are spending 0.4%, which is a little bit more. So again, this is the HIV story. It's a mixed bag in this region. Some countries are spending way below what they are supposed to be spending, and some are in fact doing better. The issue, though, is that we have to find more resources, and it's fiscal space. And I'm saying here, what I'm suggesting here, that there are two broad things, and again, they have been mentioned. You have to look for more revenues, but you also have to spend what you have better. To looking for more revenues, there are two things. Expanding the tax base is one, and increasing the effective rate of taxation. That is the next thing. Now, expanding the tax base, if the economies are not growing, that is going to be very difficult. But for some countries, you see, all expanding the tax base means is that upgrading the tax systems. There are some countries of the region that don't have any sales taxes, for example. Some no taxes on incomes. Now, in this day and age where the governments need resources, countries have to, in their fiscal systems, I think, have to include both income and sales taxes. There's the issue, as was mentioned before, the need to better target our resources so we get better value for money. Then the issue is, again, as was mentioned, the HIV response. If you could link the HIV response to other responses within the health system, that itself would be a better use of money. And the last issue of fiscal space I wanted to mention is that we live in a region where the incomes of the countries are very different. There are a few countries that are doing very well, and there are a number of countries where the incomes are very low. Now, if we have, as we feel happy about, it is a regional response, then what we actually are saying is that the hope is that each country would be able to respond to the epidemic in the way that we think it ought to. But where resources are short, the necessity of having a pool, a regional pool, so that those countries that are less capable would be able to still respond to the epidemic. That is something I think we have to seriously think about. That as a region, as we're responding to the epidemic, there has to be a pool of resources that is available so that the countries that are worst off will not be left behind. I spoke about these. The issue of, when you talk about fiscal space, and people point immediately to the high debt-GDP ratios we have. In many of the countries, the debt-to-GDP ratio is close to 100%, and in a few countries, it is in excess of 100%. But that's where fiscal reform comes in, because you can't have countries, which we do, we have countries where the per capita income is really very high, but fiscal resources are very, very low. Now, that is a crying need for fiscal reform, because as a government, if the income is being generated within the country, and as a government, you need resources to do things, you have to set up your fiscal system to ensure that enough resources come into the system. So fiscal reform is crucial. Now, the way forward, then, I'm saying that there are two things. As we said before, we expect that the donor support is going to decline. I think as a pragmatic thing, we should begin to assume that donor support is going to be cut by at least a half of what it was in 2006. It would be good for us to start behaving like that, as if that support is going to be severely cut. And it means then that we then have to get our domestic sources, public and private, to really raise the resources that we need. And in this respect, I think it would be a good signal if the governments of the region decide that, look, as far as the prevention side of the program is concerned, the government is going to undertake 100% of the prevention. So whatever resources we get from outside would assist us with building our capacity on the one hand and with our treatment programs. But prevention should be the component that should be 100% within the government sphere. It means then that the basic message that I want to send, I want people to go away with today, is that we are at a time in this region, in our response, where I think if we are really serious, if we understand how serious it is as governments of the region, we have to make up our minds that we have to bear the burden of the response, that the bulk of the resources required to respond have to come from within the region, within our own countries. As we said before, the actual requirement is ridiculously small. It turns out, however, there is a mobilization problem because, as we know, in many of the countries, in most of the countries, there are serious fiscal problems. But as we mentioned, these fiscal problems are problems that could be addressed. Now, I think in this context where we have to take responsibility, I think there's something special that we should decide to do. We have seen that to cover the HIV costs, we need about, for now, about 0.3% of our income. Some of the preliminary work that we have done on the chronic diseases suggests that to cover the cost of that response would be a little bit more than half of 1% of our income. It means that together, the NCDs and HIV will be covered properly if we put aside 1% of our income to deal with them. And I am saying that if it's one commitment we need to make as a region, is that as countries, we should put aside 1% of our income. Now, 1%. If you're earning $1,000 a week, 1% is $10. And if you are threatened by something, and you tell me you're earning $1,000 a week and you can't put $10 aside to protect yourself, then I'm saying something is wrong with you. Right? So I'm saying that the regions have the opportunity to demonstrate how seriously they look at HIV and at the NCDs. The 1%, it is not a big amount. And it is something I think that if we really believe in the seriousness of what is facing us, we are going to respond like this. Now, some people say 1%, that's an abstract term. You should call some number for them, X million dollars. I don't like to call X million dollars for two reasons. Number one, when you call a figure how much money per year, as time goes on, of course, if that figure remains fixed, there is inflation to think about, so that the value of that figure is going to be lost, and we don't want that. But the second reason is this. In the insurance world, we know that there's a relationship between your expected losses and the premium you will pay to protect yourself against those losses. The higher your expected loss is, the greater the premium you are willing to pay. And I'm saying that's exactly our position here. We expect, and we have been shown, that the HIV is going to decimate us. It's going to destroy our GDP. It is going to destroy our income base. So our expected losses are in terms of the income that we'll be losing. And I'm saying that if these, as our income is moving, the amount we are prepared to put up should be a fraction of that income. And what it would mean is that as the income goes up, we put aside a little bit more. If the income falls, we put aside. But at least we should link how much we put aside to what we expect to lose. So 1% will increase in numbers if, of course, our income goes up. The actual value of it will increase in numbers. So the basic point is that 1% does not seem to be an infeasible target. The question is, how do we do it? I think it means that there are two things. The question of ownership of the epidemic. Now, the ownership of the epidemic begins here. It begins in our hands. And we have to convince the people, those persons that are in charge of deciding how to allocate resources, that the epidemic is something that is really serious. If we convince them of that, I think then it would be an easier thing to convince them that we then need to put aside resources to deal with it. It's like a war we're in a war, and we have to build up a kind of war chest. We have to build up the funds needed in order to fight the epidemic. If we take ownership of the epidemic, it is our problem. It is our problem. Let us put aside our resources to deal with it. That's the first thing. The second thing I think that we should think about is that I think the time has come when those of us in the HIV world have to really extend our hands to those in the NCD world. Because if we go looking for resources by ourselves all the time now, we are going to run into serious trouble. I think we have to find ways to link with them. And if, as I'm saying, this 1% will cover both HIV and NCDs, it is in our interest to link with the NCDs people to clamor for the 1%. On that note, I want to end. Thank you very much.
Thank you very much, Karl. I think two things stick out in my mind very clearly here. One is a comment you made towards the end about behavior change. about behaving as if the income is going to be cut severely and looking at least 25% and then reacting in that way so our programs can actually be sustained and expanded. But the other thing I think is a very different point than perhaps we've heard in a long while is the need for advocacy efforts to start putting out a figure, a percentage that we can approach governments with to say, allocate X% of the income for HIV and NCDs. It's perhaps something that our new UN Secretary General envoy may be willing to take up, but it's a great opportunity for me now to just say we are exceedingly pleased in UNAIDS to have learned that the Secretary General has recently appointed the new Ambassador Special Envoy for HIV/AIDS in the Caribbean, Dr. Edward Green, and I'm pleased to say good morning to Dr. Green and congratulations. Our next speaker is Warren Buckingham. Warren is the director of the Office of Global Health and HIV for the Peace Corps. He leads that agency's participation in the US President's Emergency Plan for AIDS Relief, PEPFAR, and the Obama administration's Global Health Initiative. As the Peace Corps designated deputy principal to the Office of Global AIDS Coordination, he also contributes to the interagency policy setting and direction of the HIV programs for PEPFAR. He was the first country coordinator named in any of the 15 regional PEPFAR-focused countries, and he served for 15 years as the coordinator for Kenya, and the first recipient of the PEPFAR Lifetime Achievement Award. At the request of 3 successive global AIDS coordinators, he also provided assistance to US teams in India, Vietnam, Zambia, Mozambique, Namibia, Uganda, and Ethiopia. And in that, his role was primarily to see how he could improve interagency coordination and develop effective operational plans and long-term strategies. Currently, he's the designated PEPFAR Deputy Principal for Enhanced Coordination for Côte d'Ivoire, the Dominican Republic, Indonesia, Ethiopia, and Namibia. And I'm very pleased to ask him to speak as a respondent, having heard the 3 presentations, to give us some reflections on how this region can move forward in its attempts to ensure that its programs are sustainable, but also to expand it. Warren, please.
Good morning, everyone. I'm delighted to be here on behalf of my own agency, the Peace Corps, and its rich history of service across the Caribbean, but also on behalf of the interagency deputy principals in the Office of the Global AIDS Coordinator. What wasn't mentioned in that very generous introduction is that I've been working on AIDS first as a community volunteer starting in 1984, and then full-time professionally since 1986, so I also feel a bit like your designated dinosaur. I've also elected to be your designated respite from PowerPoint, so if they'd like to lift the house lights, that would be fine with me. It is Sunday morning, and some of us would customarily be in church, or perhaps after having a bit too much fun last night, some of us should be in church. So I thought I would offer a bit more of a reflection than a more traditional response to the compelling presentations that we've just heard. At the risk of making some of you nervous, and perhaps my fellow U.S. government officials very nervous, I thought I would start with a quote from Scripture. In the 29th chapter of Proverbs, verse 18 says, "When there is no vision, the people perish." We have had 30 years of the people perishing, although thankfully not so universally or so fast for the last decade. They have been perishing for many reasons, but that has always included, from my perspective, an absence of vision. Thankfully, we have heard some wonderful visions outlined this morning. We have, in our communities, in our nations globally had small visions of what needed to be done, and we have had occasional visionaries to keep us from losing all hope. But we have not, until very recently, had a big V vision of what was finally within our grasp. And this is finally possible because the accumulated impact of our efforts over these 30 years have intersected with scientific evidence of what works. And less than 2 weeks ago, I was privileged to be seated in the auditorium at the National Institutes of Health in Washington when Secretary of State Hillary Clinton pronounced that bold vision that is within our grasp, an AIDS-free generation. I must say that you had to be in the room to get the full impact of that pronouncement. But if you weren't able to be there, and if you haven't yet done it, I would encourage you to go to the state.gov website and try to get a sense of it, because the video, the streaming video of her speech is there. I was diagnosed in 1988 with AIDS, and I've been on ARVs continuously ever since, and thankfully have been kept alive by long-term participation in a clinical trial at NIH. But with all of that, I have to confess that I didn't expect to live long enough to hear those words pronounced and to hear them spoken so definitively by a world leader. But to be absolutely clear, neither she nor we should envision an AIDS-free generation because all of us who are infected die off. Instead, we can envision an AIDS-free generation because those of us who are HIV positive have been kept healthy. We can envision an HIV-free or an AIDS-free generation because, as we've heard, we can bring PMTCT programs to scale and make sure that no more babies are born with HIV. We can, together, achieve the rates of treatment coverage needed to hit the tipping point where community viral load drops so low that new infections are background noise. And as several of the presenters have said, we can, and in fact, in the current resource environment, we must focus our still significant funding and our abilities in prevention with laser-like prevention on what is evidence-based, on what we know will work, and being honest, as Amalia said, to stop doing what we should not be doing. How does all of that intersect with sustainability, the subject of this plenary? I was inspired by my friend Alan Whiteside's use of Wikipedia in his presentation to go there myself. I was a little depressed that the definition of sustainability, the one he put on the slide, starts with the capacity to endure. Because I don't know about you, but I've endured just about all of this epidemic that I can. I needed something more, and thankfully, thanks to the internet and Wikipedia, the something more is there. In between the passages Alan quoted, Wikipedia reminded me that sustainability, and this is a direct quote, sustainability encompasses the concept of union, an interdependent relationship and mutual responsible position with all living things on Earth. It is that view of sustainability, our shared responsibility toward one another, that will get us to an AIDS-free generation. Every one of us, whether we are bringing money or human capacity or righteous anger or cutting-edge science or critical analytical skills or the helping hands of a Peace Corps volunteer or just the experience of living with HIV, is essential, and we are all responsible to and for one another. I know that some people cynically think that the PEPFAR focus on country ownership of the last several years is about donor fatigue. But I want to assure you that I spend most of every Monday with my colleagues from the State Department, from USAID, from CDC, and from the Department of Defense. And while we are tired about some things, we are not fatigued about the future. What country ownership is about is ramping up the focus, which does make some people nervous in the current economic climate, the focus on HIV as a shared responsibility and the need, the imperative, to squeeze every possible efficiency out of the system. For example, as Secretary Clinton said in her speech, it is unacceptable for countries to reduce funding for health because of increased donor support for HIV. And we, activists, donors, and others, have a mutual responsibility to call them on it when it happens. Karl just outlined a bold approach to effectively expanding the fiscal space. In the original version of his presentation that I had, he concluded that, quote, the sustainability of the HIV/AIDS response in the region is, in a very real sense, within our hands. Note that he didn't say your hands or some amorphous their hands or my hands, but our hands. That means all of us. Because I was lucky enough to spend 7 of the last 10 years living on the African continent, and because I am always both inspired and daunted by the African on this panel, I want to introduce you to, or remind you of, a single word that sums up everything Wikipedia or anyone else might say about sustainability. That word is Ubuntu. Nelson Mandela and Desmond Tutu, among many others, frequently use this word to make clear how much we need one another, not out of any sense of dependency, but because we simply aren't all that we can be, our best selves, our best societies, our best nations, unless we are connected to one another. In this region of incredible beauty and diversity, of great wealth and great poverty, all of our epidemics are connected. And I know, in many ways, because of shorter and longer and wider and narrower air and sea bridges, the epidemics of the Caribbean are integrally connected to the epidemic in the United States. If we recognize, if we celebrate, if we respond to, and we capitalize on all of those connections, and each of us brings all that we can to the cause, I believe we will live to see that promised land of an AIDS-free generation. Ubuntu.
Thank you very much, Warren. And as we come to the end of this plenary session, I'm left with a couple reflections that I want to share with you. I think when we look at it and we start speaking about regionalism, we sometimes think of that in terms of governments and institutions. But what HIV/AIDS has done for us in this region is reminded us very clearly about who we are and want to be as a Caribbean people and what we stand for, and the type of people that we want to fashion. And that requires us to perhaps sometimes go back to our national anthems and understand the phrases that always speak to us being one people, together, working, and being our brother's keeper. And the sustainability of this response is not going to be built on financial resources. It is going to be built on us. Enjoy the rest of the day. Thank you very much.